Welcome to the Pathways Research and Training Center's January 24th webinar, Engaging Adolescents with Serious Mental Health Conditions in Treatment Planning, Findings from a Randomized Study of Achieve My Plan. I'm John Osowski, Director of Dissemination for Pathways, and I'd like to begin with a few housekeeping announcements. Please see the advice on this slide to make the most of your go-to meeting experience. In particular, please note that during the presentation, all audience members will be muted, but you can send your question to us via the chat feature. A recording of this webinar will be made available online shortly after the webinar ends and will be available from the link shown below. At this time, I'd also like to invite everyone who registered for this webinar to stay in touch with Pathways RTC by signing up for our monthly RTC updates. We feature links to Pathways resources like this webinar, as well as news and events of interest to the field. You'll receive an invitation via email after the webinar, and we hope that you will accept it. This webinar was made possible through funding from SAMHSA, the Substance Abuse and Mental Health Services Administration, and NIDLR, the National Institute on Disability, Independent Living, and Rehabilitation Research. And with that, I'd like to welcome you all to today's webinar, Engaging Adolescents with Serious Mental Health Conditions and Treatment Planning, Findings from a Randomized Study of Achieve My Plan. Our panelists today will be Janet Walker, Mary Beth Welsh from Pathways RTC and the AMP Project, and also Caitlin Baird from Youth Move Oregon. They'll be telling you more about themselves in a moment, but first, we'd like to learn a little bit about you. I'm going to launch a quick poll, and I hope that you can just tell us a little bit about your role relative to your work. And so we'll give a few more moments for folks to vote, and just let us know which one best fits your role. Okay. We've got about 2/3 of people voting. Let's see if we can get it up to 75%. And great, I'm going to close the poll now. Thank you for your voting. We've got about over 80% of folks have responded. And now I'm going to be sharing the poll results. So as we can see, most of us here that joined today are going to be service providers or managers, followed by a fair amount of evaluators and researchers and family members. And of course, we welcome our young adults with lived experience as well. And with that, I'd like to turn things over to our panelists so that they can introduce themselves to you.
Hi, my name is Mary Beth Welch, and I am, as the slide says, a peer support training specialist. I work on the AMP Plus project through Pathways. I've also grew up within the mental health system and the foster care system, and was able to use that experience as a peer support for young adults that I got to work with, and now I get to use that experience in this position.
Thank you, Mary Beth. My name is Caitlin Baird. I'm the Peer Services Manager with Youth Move Oregon. I am also a trainer and consultant for Oregon's System of Care and Wraparound Initiative project. I too experienced the mental health system as a youth, as a young adult, and now as an adult consumer, and I'm really excited to be here today.
Thanks, and my name is Janet Walker. I am speaking to you today primarily in my role as Director of the Pathways Research and Training Center, and also as Principal Investigator on the Achieve My Plan projects. But I also wanted to mention my role with both the National Wraparound Initiative, which I co-direct with Eric Bruns from University of Washington, and the National Wraparound Implementation Center, which Eric and I co-direct with Marlene Matarese from University of Maryland, because we are going to be bringing in towards the end some work that has been undertaken under each of those organizations. Next, please. So So just a tiny bit about the Research and Training Center. As John mentioned, we're funded by SAMHSA, HHS, and NIDLR, which is also part of SAMHSA now. We're in our second 5-year funding cycle, and our goal is to improve outcomes for youth and young adults with serious mental health conditions. Again, I just wanted to reinforce our website because we're going to, throughout today, we're going to be mentioning a number of publications and other resources that you can get via our website. And there are 2 ways to get to it, again, using the search bar on the home page or the featured presentations button in the navigation bar. Next, please. So this is an NWIC slide. I mostly just wanted to show it to give people a sense of how widely implemented Wraparound is now. This data is based on the Wraparound survey that was done, I think 2 years ago, the data, so probably you would see a few more states in blue as representing statewide implementation of Wraparound. But generally you can see that Wraparound is pretty widely implemented across the country. And just to backtrack for a minute, when we're talking about Wraparound, for anyone who's not familiar with that, what we're talking about is a well-defined team-based process for creating a comprehensive care plan that includes services and supports for children, youth, and increasingly young adults and their families. And these are young people with the highest levels of mental health and related needs. Now, like other person-centered planning processes, Wraparound process is supposed to be primarily driven by the perspectives of the client or the person who's at the center, and that in this case would be the young person and family. And they are regarded as the primary sources of information regarding what the needs or problems are and what service and support strategies are likely to be successful. Next, please. So what we're going to talk about today is why did we feel a need to enhance Wraparound in the first place. So we'll start with that in a moment. And then moving forward to discussing how we developed the Achieve My Plan intervention by looking at research-derived practices that we felt would be worth including within the enhancement. And then talk a little bit about the coaching process that we use to make sure that people who are implementing AMP are in fact using the skills that we want them to and using the intervention or the enhancement intervention to fidelity. And then just a little bit about the technology that we use to make sure that that happens. Next, please. So again, this is a publication that can be accessed and downloaded for free from our website, and it kind of goes over the initial research that launched us into the AMP project in the very beginning. And research at that time showed that few young people were meaningfully engaged in participating in team-based care or treatment planning, and that included these various different settings, such as the school or IEP, where we found that young people, even though there was a federal mandate that young people over a certain age would be involved in their transition planning, they were often not there, and that the plannings, if you looked at the plans across a given school, often they would include exactly the same services and supports from one plan to the next. Similarly, within systems of care generally and within Wraparound in particular, we also found evidence that young people were either not in the planning process or not engaged. And in our own work, we found that professionals were very dissatisfied and felt that lack of youth participation was one of the biggest challenges in their work with Wraparound. And I'm going to talk a little bit more towards the end of this, but and certainly our ongoing experiences reinforce that this is still kind of an issue with Wraparound, that young people are, I would say, primarily often not very engaged in their own Wraparound team, and that they have limited voice and choice. And I'm going to welcome you at this point if you want to comment about what you've seen in Wraparound or other team-based planning for good or for not so good, and chat it into us so we can maybe reflect on that towards the end of the webinar. Next, please. So just again to, these are studies that you can find out more about on our website. The original study that I was part of was published in 2005, and you can see there from the bullets we often found that the young people were not even at the meetings. Less than half the time they were there for more than half the meeting, and often they were sort of kicked out partway through the meeting, which if you talk to young people about that, makes them feel like, well, that's when all the important stuff gets decided. We also saw young people who were very disengaged. They were sitting around playing with, at that time it was usually a Game Boy type of thing, or sleeping on the table. And our data show that youth were more dissatisfied than other team members, less comfortable during the team meeting, and saw more conflict on the team. And again, providers cited lack of youth involvement as one of the top challenges with team meetings. More recently, we did a study that was included, it's actually 3 studies that we reviewed in this article that included youth up to age 20 from some very large data sets. And we found, again, young people less satisfied than either their parents or care coordinators as far as their level of participation and satisfaction with the process, that older youth tended to be more dissatisfied than younger youth, and that youth rated their own participation lower than their caregivers did. And there was also some evidence of what we kind of refer to as crowding out, as that where youth felt that their participation was higher, that their caregivers might find the caregiver's participation lower. And this is obviously troublesome because we certainly don't want participation to be either or between the family members and the young people. Next, please. So what's to be gained from increasing youth participation? Usually this isn't something I have to convince people of, but I just want to go over some of these basic points. Obviously, youth voice and choice is part of the first principle of Wraparound, so people who are engaged in Wraparound have a philosophical commitment to doing this work in a manner that makes sure that the youth voice is really represented. There's quite a bit of research actually that shows the way that engagement increases when people feel that they have voice and choice. And I have a colleague who often, has characterized, he says that choice is an evidence-based practice, and I actually think there's quite a bit of truth to this. People who feel they have a choice when they're undertaking an activity have more interest, excitement, and confidence and commitment to act on the chosen options than people who didn't feel they have a choice, even when it's the same activity and the same people. When adolescents in particular choose activities, they have more positive mood while they're engaging in the activity, higher well-being, and better performance. We also find, so one of the things that we are expecting is that when young people feel they have choices within their team, that they would have improvement and improved engagement with the team, which in turn should lead to better tailoring of services and supports to fit with what the youth thinks is going to work and what they want to engage in. Increased engagement, therefore, in the services and supports that are part of the plan, so-called higher dose of those services and supports, and we assume they are going to be helpful, so that should improve outcomes. And then what we're looking for too with improved engagement is a sense of alliance with the team. And there's again a very large literature that looks at therapeutic alliance between, this is mostly looking at individuals and their therapists, but both for older people and for younger adolescents and young adults. We know that team alliance has an important effect on outcomes regardless of the treatment modality that is being used, and may in fact be even more important than treatment modality itself. So we also know that acquiring self-determination skills, so those are the skills that are required in order to feel that you can make and achieve plans that are personally meaningful to you and achieve your goals, that achieving these skills is a key developmental task for that older adolescent and young adult period of life, and also that it's very valuable to have self-determination skills. And people with higher sense of self-efficacy and self-determination tend to be generally more optimistic and hopeful and persistent in pursuing goals in the face of obstacles. They also have generally better mental health. They cope better, avoid depression, and are more likely to adopt healthy habits and maintain behavior changes. And importantly, for young people, we know that young people who are exposed to self-determination curriculum, these are young people with disabilities, particularly in this research, do better after high school on a wide range of indicators, all the way from independent housing, earnings, and quality of life. Next, please. So again, we're going to move on to the next sort of episode of the webinar here, where we're going to talk about what we incorporated into the Achieve My Plan enhancement intervention. Okay, next. So I'm not going to go into it in a lot of detail, but again, we have another handy publication on the Pathways website where we really talk about the research that went in behind each of the sort of little bits of the curriculum that we developed for the Achieve My Plan intervention. And so we took likely candidates from the research, and we vetted and refined these through extensive work that we did with our advisors. And our advisory group included young people who had been through the mental health and related systems, who were the kind of young people who might have participated in Wraparound had it been available to them, and also with caregivers and family members, because we wanted to make sure that what we were developing was something that everybody was comfortable with and could get behind. And so the kind of general categories for supporting participation that we developed included obviously a need for organizational support, which I'm not really going to talk a lot about today unless we have times in the questions, but within the work that's done between young people and whoever is preparing them to participate in Wraparound, there is coaching prior to the team meeting preparation, which includes okay, so the coaching, I got a little problem with the bullets there, but basically we have a preparation phase that we focus on where the young person is prepared to participate in the team meeting, where they spend some time thinking about what's important to them and how the team can help them reach their own personal goals. And then during the meeting, some support for the youth's participation to ensure that they're able to say the things that they want to say and express themselves clearly to the team, but also that the facilitator and other team members are committed to having the meeting unfold in the way that the young person prepared for. And then finally, some stuff around accountability and following up to make sure that after we had this great meeting where people agreed to do things to help the young person with their plan, that we're able to check up to see how things are going and whether people are able to follow through on what they proposed. Next, please. So again, we took our enhancement intervention that we developed. I mentioned already that we had an advisory board, and that our main goals with finalizing the intervention had to do with the bullets there at the bottom. We wanted to make sure it was something that would be feasible within resources of agencies, and in fact that it wouldn't really require any more resources than they were already devoting to working with young people through the wraparound process, that in fact it would just be a kind of a restructuring of the time and the specific kind of methods that they were using for doing that. As I mentioned before, we wanted it to be appealing so that providers and caregivers wouldn't be worried about the meeting being hijacked or caregivers having their perspectives crowded out, but we also wanted something that young people would find obviously engaging, since that was the whole point of what we were doing. And we were also hoping that it would have kind of a dramatic and immediate impact. Next, please. So again, as I mentioned, the enhancement, we call it sort of, I tend to slide between enhancement and intervention, But essentially, it's a process for incorporating the best practice that we identified right into regular wraparound practice, so that the work that's normally going on to engage and work with the youth is simply structured in a different way. And the intent of that is to, of course, increase voice and choice, and to have the young person really practice those skills for self-determination. So the person that's working to prepare the young person for the wraparound team experience helps them come up with activities where they can take the lead. And the goal there is for them, for the coach and for the young person, the coach will model and teach self-determination skills, which the young person then gets a chance to practice in a really real-life situation. And the coach also focuses on preparing the young person to collaborate effectively and in a what we call sort of a pragmatic manner with the other team members. So it's not something, again, that's really qualitatively different from what wraparound preparation might look like otherwise. It's just a more structured and intentional focus on the active ingredients of engagement and self-determination. And the curriculum itself, which we're not going to go to in a whole lot of detail, is structured into modules and boosters, which kind of all happen in a row the first time that they're employed, and then are flexibly kind of recycled as they're needed once the kind of initial work of developing AMP components of the wraparound plan have been done. Next, please. Okay, so I'm going to turn it over to Mary Beth and Caitlin to talk a little bit about how they actually work with young people in the AMP process.
Thanks, Janet. So this part is talking about preparation for the meeting. So you want to make sure that the young person you're working with knows what's going to happen and what they're gonna, what they want to say, how they're going to contribute. So that includes going over all of the agenda items before the meeting, so that they know what they want to say, they can practice it, talk about how they want to say it in a way that will get people on their team to listen to them and want to join in and help with that. Talk about strategies for, how you want to stay calm and focused, how the young person wants to. And if that doesn't happen, how can they get support? I don't know about you guys, but one thing that I've had happen is somebody brings up something that I wasn't expecting, and so then all of a sudden in a meeting I get flustered and I don't know what to say. That happens for everybody, so it's really important to make sure that the young person knows what's coming up and that there's a plan, so that if something comes up that they're not prepared for, how do you handle that? Next slide, please. Oh.
Something else that I would add really quick is that it's important to take time with the preparation phase. If you're meeting with the youth just shortly before the meeting and going over agenda items, a lot of times young people who are in these situations feel stigmatized and just want to say whatever needs to be said to get it over with, yeah, so to speak. So take some time, build some rapport. I think that piece is very important.
Cool. So the next slide. So building that rapport using engagement tips is very helpful. So things like reflections, open-ended questions really help get the young person to open up, talk about what's important to them, and feel less therapized is one term that we use. So this is a tip sheet that we have on the website, Pathways RTC, and it goes over different examples of what can be said instead of what often is said. You want to keep open-ended questions open-ended without capping them with like a suggestion. You want to ask a question of the young person to kind of prompt them to think through something themselves instead of giving the answer immediately. These are just a couple of different tips. What are you? Cool. All right, next slide, please. During the meeting, you want to make sure that, the ground rules are individualized to the young person that you're working with. Not everything works for everybody, so this is something that can be talked about in preparation, so the young person can add or subtract from the ground rules and really come up with a plan to stick to them. So then you want them to be enforced in the meeting and gone over with the people that are in the meeting. really plan to use the parking lot. So that's something that is helpful, that if somebody brings up something in the meeting that is completely off topic and the young person hasn't had a chance to prepare for that, it goes into the parking lot. That's something that's talked about at the end of the meeting to figure out who needs to be there to talk about that topic, when can we schedule a meeting to talk about that topic, and then really make sure that the young person can prepare for it at another time to talk about it. That really goes in line with not springing stuff on them and keeping people from being flustered. You want to begin with activities that are related to goals that the young person sets. So not necessarily everything that the team members want. It's important when you're bringing in youth voice and choice to really emphasize what they want. And then you also want to build in more facilitation practices, enhancing collaboration, so you're really bringing in the young person specifically. If it comes down to a bunch of team members are talking to other team members about the young person, really pulling in the young person, being like, what do you think about this? That also really brings in the young person's participation also. And you want to interrupt when other people are doing that, because it also is teaching them how to effectively communicate with a young person in a treatment meeting. You also want to keep it focused and efficient. Just keep it on track. Follow the agenda that has been prepared with the young person so that, again, things don't get thrown off. And really make sure that people know what they're supposed to be doing as you leave the meeting, and have a plan for holding people accountable to that, what they are agreeing to do and what they are supposed to do. And that's not just the young person. A lot of time coming out of meetings, there's that expectation that the young person knows what they're doing, and that's not always, and that's it. And so then, there's the expectation that they kind of pick it up and go with it when there's needs from other team members as well.
I think something that's important to keep in mind as well in terms of just having some of these slight changes in practice and these emphases is that incrementally you'll see over time that your team will naturally begin to follow the principles a little bit better, and the youth is going to feel over time more empowered to participate and really take control of their treatment planning and their meetings.
Definitely. Next slide, please. So these are a couple more tip sheets. The first one where it's talking about during meetings, I can't stand it when. This was put together by quite a few young people about things that come up in meetings that they don't like. Some of these have already been mentioned when people are talking about the young person like they're not there, when no one asks what they think about it, what the young person thinks, and they're just like, all right, this is the plan. That's not always appreciated. When people don't even bring up what the young person might want to talk about. So these are all different things that can get in the way of youth engagement. And so this tip sheet is really great for providers to look at and kind of as a reminder of how to adjust for more youth engagement, more youth collaboration. The second tip sheet is tips for young people in how to really engage into their team meeting themselves. So how are they going to get what they want out of the team meeting? And this has a couple of different things to really prepare them for that. So again, both of these can be found on the Pathways RTC website. Next slide, please. So when I was talking about accountability a little bit ago, it's really about keeping to the plan. You want to, within the meeting, record what's being said so that afterwards you can follow up with who did what. So you really want to make sure also that the young person can walk away from that meeting with the decisions as well. So who said that they're going to do what? So the young person can follow up, or they can meet with their provider and be like, okay, so I was supposed to be getting this help from this person. Can you help me get support from them in this way? That kind of a thing. Also, it's important to check in to make sure that you did everything that you needed to do to be prepared. and also check to see if, like, within the meeting, did you guys follow the agenda? Were the ground rules enforced? Was everything done as it was supposed to be? And then also check in with the young person to see how it went for them. Like, we're bringing in youth voice and choice. It's important to know how it worked out for them. And, you know, consider what they did to participate, how they felt about that, and were they, was there any additional support that they might have wanted? Was there any other kind of thing that they wanted to talk about? How did it go? And is there something that they want to see it different another time?
Something else I would highlight with accountability is by doing this, it not only keeps the young person accountable, but it empowers them to keep their team members accountable. So that's something that can be really, really powerful for a young person who often feels stigmatized being a part of certain systems. If not only do they see that they're being held to a certain expectation, but they get to hold their team members and their service providers to a certain expectation as well.
Definitely. Next slide, please. So these are some general observations that I've noticed as I've worked with training some people in AMP. There's been some frustration when a provider is starting to work with a young person and it's like they're trying this new approach and the young person doesn't immediately take to it and it's like, yes, I want to like participate in my meeting and lead it fully and I don't want to like, I want to make all of the choices and everything. You can't expect the young person to just, you know, immediately be on board and do that because it's a pretty radical change. So going from kind of having that empowerment not necessarily enforced and sometimes taken away to be like, all right, take the lead, that's a big difference. So you can't really expect it immediately. So really think about planting seeds. It might be frustrating a couple of times while you're trying to prepare for a meeting and it's like, wait a second, I'm trying to switch this up and the young person is not as engaged as you would like them to be. It comes later on, I promise. It gets easier. They're like, as there are more successes, there's more like, wait, I want to do this. That's where that empowerment comes in. But then there are also times where youth engagement ebbs and flows. So just because for the last meeting they were all about leading all of this doesn't mean that they're going to be ready for that the next meeting. So you really want to be prepared for, you know, really adapting to what the young person needs. Again, bringing it back to youth voice and choice. Just because they're able to do it one time doesn't mean they're going to be able to do it next time. Or they might say that they're uncomfortable leading anything, and then you get into the meeting and they're like rock and roll and like going with all of it. That happens too. So really being prepared for adapting is important. Anything you've observed?
I think that you put it really well. One thing that I often tell communities when we're talking about implementing wraparound in their community is incremental, not instantaneous. And I think that that phrase applies to this situation really well as well. There's a lot of youth that you'll be working with where it really will be incremental growth that you see. It's not going to be instantaneous. And I think that sometimes the expectation that it will be instantaneous is actually setting everybody up for failure, not just the youth, but the team members too.
All right, next slide, please.
Okay, well thanks guys. So just a quick note that if you want to measure some of the accountability aspects that that Mary Beth mentioned just a moment ago on that slide, we have measures, and you'll be hearing about these in a minute, that we actually also used in our own randomized study that include the youth participation and planning scale and the youth empowerment scale for mental health. And we have introductory packets for both of those available on our website, and as well you can see the journal article that talks about the development as well. Next, please. So now that you hopefully have a sense of what AMP entails, I'm going to talk just a little bit about the study that we did. It's a small-scale randomized study which was comparing Wraparound as usual with Wraparound plus the AMP enhancement. We had participation by 55 young people plus their care coordinators and team members and their caregivers, and the care coordinators were the ones that were randomized. So we randomized care coordinators into RAP as usual versus RAP plus AMP, and then young people were assigned as they came in to the care coordinators who had space. All of the coaching was provided by university interns, and these were both undergraduates and master's level, and we actually trained them within about 4 weeks to do this, and they interns, or what we call them, the AMP coaches, had about 6 hours of contact time with the young people to prepare them for what we call the first AMP meeting, so the first wraparound team meeting where they were going to be using the AMP process, and then attended that meeting and the subsequent meetings. The assessments we gave at baseline, and then after the first target meeting, so that was the first AMP meeting for young people who were in the intervention condition versus just a regular identified AMP meeting. I mean non-AMP, just regular wraparound meeting for those who were in the control. In our period, then we did one after that, so we did baseline after the target meeting and then after the third meeting, so that was about 11 to 13 weeks out. So those assessments were phone, or mostly they were in-person assessments, although the care coordinators did them online. We did, especially after the first, if the young people wanted to do them over the phone, we would do them over the phone with them. We also analyzed the video recorded team meetings, and we had every person who was present in each of the 3 meetings do a post-meeting survey. Next, please. So the assessments, the first thing we found out was we couldn't get caregiver assessments that were useful, mostly because our young people were in a lot of different placements, and because our design wanted us to look at change within people, and we didn't have the same people, we weren't able to actually use the caregiver assessments. So we used the youth and the care coordinator assessments, and what we found was that across each of the 3 dimensions of youth participation that we measured, so they actually have to do with preparation for the meeting, participation during the meeting, and feelings that things are accountably happening after the meeting, they were all higher in the intervention condition, and it was all significant except for the accountability. So between T1 and baseline and T2, we did see improvement, significant higher in the treatment condition, but not between T1 and T3, so that deteriorated a little to the extent that it was no longer significant. We found our youth empowerment higher in the intervention at all times, but not significantly so. But we did see significant improvements in team alliance, which is, as I was talking about before, the analog of therapeutic alliance that was higher in the intervention condition. So I have a little chart on the next slide, and I primarily put this in so that people who are interested in downloading the slides can actually take a look at numbers if they want to look at those. I'm not going to try to go over it because it can be very confusing to try to absorb, but it's what I summarized from the previous set of bullets. Next, please. So as I mentioned before, we video recorded the target meeting. Again, we saw that every aspect of youth participation that we were measuring, so we coded 20-second increments of the entire team meeting. And everything we were looking for that was good happened more in the intervention condition. Everything that was bad happened less, but it wasn't significant in all cases. What we did find was that young people talked more. They talked for whole segments more. They also gave more what we were defined as high quality contributions, meaning that they were not just sort of saying yes or no or responding to those questions, but they were making contributions to the plan. They were making sort of evaluative statements about the services and supports that they received, and they also interacted with the team positively more frequently. We also found that the team invited the young people to make more high-quality contributions, and they were more likely to act on youth ideas. We also found, and this was something that we wanted to look at because of a pilot study that we did, where team members in the AMP felt that AMP meetings were more efficient than the meetings that they had been before. This was a pre-post type of a study that we did, a very small study. And we found in this one that there was more kind of process talk with the team, with that kind of talk that's usually associated with making sure that the agenda is being accomplished. So it's things like, well, what item are we on now, and should we move on from this one now? Shall we check in and make sure that everybody knows what they're going to do? So all those kind of process comments were again more significant and happened more often in the intervention condition. So again, I have a slide here, the next one please, which summarizes all of these findings. And we did, I think, fairly conservative statement about what's significant or not, because both with the slide that I showed you before and the slide that I'm showing you now, we adjusted all of the p-values, so the significance, to account for multiple comparisons using a false discovery rate adjustment. So you can see that in the final column is looking at how we kind of were conservative with those significance p-values. Next, please. Finally, with our post-meeting survey, so these were surveys after each meeting that everybody filled out, we found that there was a significant main effect in favor of the intervention on each of the three main things that we were looking at. So we had a youth participation scale, which asked each person how much they thought the young person was, various dimensions of their, I think there were 6 questions on that scale, that people, how much the youth was, that reflected youth's active engagement in the wraparound process. Then also, as I mentioned before, we thought, we looked at the getting things done. So, you know, generally, did the team feel that important and meaningful work on the plan had happened? We were very anxious to show or hopefully examine the idea that somehow including youth participation doesn't detract from the team's ability to accomplish its other tasks. And we also looked at a single item that the meeting was much better than usual. So we found that in the intervention all of these were significant for across all of the meetings. There was no interaction effect indicating caregiver dissatisfaction, so in other words, we didn't see that caregivers were in any way less satisfied with things as far as being much better than usual, etc. So no evidence that we found of their perspectives being crowded out by increasing the focus on youth voice and choice. We did have some fall off in the youth participation by the third meeting, which was a little bit problematic, but that was the point where our coaches were stepping out and the work was being turned over to exclusively to the care coordinators to do kind of carry forward the AMP process with the young people. Next, please.
Janet, before we move on, we did get a couple of questions in about the stuff you're presenting now, so I thought it would be good to answer them. Regarding, so when you, when you were setting things up, about how many hours of training of the interns was required?
I would say that our training was probably about maybe 15 hours, and I'm going to talk about that more at the end. So I think we have a very effective training process, so I'm going to that's one of the things I want to talk about later.
Great. And the ages of the youth involved?
Let's see. I think they were basically 14 to 18. Yeah, so if they started before they were 18, they could continue on.
Okay. Thanks, Janet. Next slide.
So again, just to sort of reiterate, I know that Mary Beth and Caitlin kind of talked about some of this, but things that are different in AMP from what we have seen within wraparound practice and other team-based practices include really the focus on teaching skills for self-determination. I think in many of these kinds of interventions, they're very focused on planning and carrying out steps, so on, but the teaching aspect is sometimes not stressed so much. Really not focused on the plan itself so much. But what we really want is for young people to know what it's like to create a plan and then carry out those steps. And sometimes the original goal is not the goal after the second or third meeting, but it's the process of learning how to be what we call the change agent in your own life is what we're trying to give people that experience and and skills for. And then again, we really focus on working productively and pragmatically with other people. What is the best way to work with maybe a problematic person, but so that you will be able to use their help if possible in reaching your own goals, and how to access support and help. And then our training approach, which I'm going to gets back to that question that was being asked, which really focuses on concrete observable skills in our AMP coaches. We think that having a good curriculum, good set of tools is really important, but doesn't guarantee that youth-driven conversation, which is key to the process and really not as easy, I think, as many people assume that it is. It takes more than good intentions to really have a youth-driven conversation. Next, please. So just briefly, we have moved away from university interns in our practice because they're not generally available to everyone. So now we have been working in several states and regions and counties and stuff to do original AMP with care coordinators delivering the entire AMP curriculum, just as their normal interaction, engagement, and kind of checking in with the young person that they would be doing anyway. We're also working on an AMP enhancement with Wraparound in Massachusetts with young adults up to 21, and we're writing that study up right now. And we're also developing two versions of AMP that we call sort of standalone that don't require being part of Wraparound, that is basically focusing on that youth-driven skill building, self-determination, but also planning process. So we have the transition facilitator version, AMP-TF, so typically those are young people who are sort of working one-on-one with a transition facilitator, and they may or may not have teams that they need to work with as well, so that's a flexible part that we integrate. And then we have the AMP Plus, which is a peer-delivered version of AMP, and again, whether that's focused on working with a team or focused on a peer who's really just helping the young person kind of make some headway on personal goals in the community. And we're finishing a study now where we've been training peer support providers in Kentucky and in Oregon. Next, please.
Janet, before we move on to that, just one more question about the study. Did you notice any gender effects regarding participation, satisfaction, etc.?
No, we didn't, although it's conceivable that had we had a larger sample, we might have been. As you saw, there was sort of a small number, so we were really only able to pick up on the most biggest impacts. So it's an open question to me, but no, we did not.
Okay, thank you.
So this is getting back to our question about the university interns. One of the things that we were very pleased with was, again, this was a short study. We were looking over, basically 3 months, but we were able to see fairly dramatic changes in sort of team behavior and satisfaction, youth engagement, etc. So I just want to talk to you briefly about how we were able to get our university interns up to speed with relatively short amount of coaching. And I would say, I don't think we actually timed it out, but I would say somewhere between maybe 12 to 16 hours of training on average. And that was, next slide please, I think very much because of our use of what we call the virtual coaching platform, which allowed us to do this video-based coaching of their practice. And Mary Beth and Caitlin, both of whom have use of ECP in different ways, are going to talk to you just a teeny bit about what it is.
All right, so the virtual coaching platform, this slide really shows what it looks like from our end. A video is uploaded. We make a preparation out of it that we can score and look at all of these different parameters. So we're looking at, you can put whatever parameters are important to you in this moment, strengths and youth-driven, all of that, but that's each thing we're looking for. We don't expect to see them in each segment that we're looking at because that's kind of impossible, but we're hoping to see something in each segment. Often we have them split into 1-minute segments, but they can be however long you want them to be. So this in this example, it's a 47-minute video broken down into 1-minute segments, and we're looking at all of these parameters in each minute. But again, you don't see all of them in each minute because then you're not doing actual use-driven work if you're trying to shove everything in. So it's really, hopefully we see something in every minute. Next slide, please. Coming out of that video, once we've scored it, you can get a feedback report, and this is what that looks like. So with each thing that we score, we can also write a comment, and so those comments can be put together in this report that the coach that is being trained on the AMP approach can see those comments. It relates directly to the minute that you were watching, that you made that comment, so then they can go back, watch that minute in their video and see how your comment applies to that, and kind of really look at their work that they did and also how they can improve it. Next slide, please. So some helpful things about BCP, as I mentioned a little bit, like they can see their own work, they can watch their own videos that they've uploaded, which can be really scary. Filming yourself in general doing your work is kind of scary. Watching your video is kind of scary. But it gets easier, and it's so helpful being able to see what you did, and like if you're watching it after the fact and in the moment you don't really necessarily notice that, like, ooh, I could have done this other thing, or oh, this was an opportunity to bring in this skill. But once you watch the video afterwards, you're out of the moment and you can see it. That helps retrain yourself to, in the moment, really analyze what you're saying so that next time you can catch it. The more you watch your own videos, the more you get this feedback, you're able to really kind of provide feedback for yourself even. A couple other things that are helpful with VCP is you can watch example videos and clips to see kind of maybe what's not the best and what is good, and like how to improve that, not necessarily from your own videos, but other videos that have been taken. As a trainee, you're able to clip your own videos to ask a supervisor, what about this specific part? Or this supervisor can be like, this is a specific part that I want you to see, and let's talk about this. So then not the entire video has to be watched, just this clip. And again, with the feedback report, it's really helpful to be able to see the comment and see it apply directly to the video that you uploaded and know exactly what is being talked about.
Absolutely. Something also that's very helpful about the VCP as a supervisor who codes AMP videos for their staff is being able to see what techniques are utilized a lot and maybe what techniques can they build some more skills in. It's also a very easy tool for folks to use, and I feel like it's very, very helpful as a coaching platform, particularly for in vivo coaching, which I think a lot of the times when we're doing some direct service work can really be hard to incorporate in a way that feels trauma-informed, and this allows us to do that. So rather than having a supervisor like go directly with their staff to see how they're working with a user or family, this is a platform in which you're able to see techniques that they might be utilizing, how they might be working with youth, without making the youth feel super uncomfortable.
Mm-hmm. Cool. Next slide, please.
All right, so I'm not going to belabor this slide, but I just want you to take a minute to focus on the orange bars there. This is basically showing, based on a meta-analysis of education studies, that practice change, which is the orange bars, doesn't really start to happen much until you've given people not just theory and demonstration of the practice, a chance to practice the practice and get some feedback, but really until you get that coaching, which incorporates information about how they've actually performed. Next, please. And increasingly, I think people are recognizing that transfer of training to practice requires those elements that I just mentioned to be in place. So it requires, first of all, that there's kind of a clear conceptual model that explains to people what they're supposed to be doing and why, and then that they're provided with concrete, specific skills and competencies so that they know what good performance looks like. Then that there is some observation of their practice, and that they get feedback that's reliable. And by reliable, I mean if they went to Supervisor A or Coach B or Supervisor C, they would get basically the same feedback, which says these are the places where you're doing well, these are the places where you're maybe not doing so well. And that then the feedback should encourage, again, should have show development of competence, should be able to be used to benchmark when people are to a level of competence, and that once they become reasonably expert, there should also be periodic checkups to ensure against drift. So we're very quickly running out of time. So next I'm going to go maybe just skip through this a little bit about boosting skills for family youth-driven practice. Next, please. So one thing, this is again sort of switching into some different work that we did through the National Wraparound Initiative and some other contracts, was really looking, using our video material. One thing that we noticed was that people, even people with quite a bit of experience in wraparound, seem to lack some of the important skills for really doing family and youth-driven conversations. So we actually engaged some experts from the NWI in a little study where we asked them to rate some video and to tell us what they were seeing as far as good and not so good practice. So we had everybody go onto VCP and rate the same, a couple of 10-minute segments. And I'm going to skip by the next slide. I think is just a graph. But basically people didn't agree. We had one segment that we thought we rated using our observation tool as being beginning practice and the other one as being competent practice, but we didn't really see that people were matching our ratings or even matching each other's ratings very well. Next, please. Additionally, we found out then when we asked them what they saw going on as far as how the practice was, that there was some level of agreement about what was going right, but that people really didn't agree at all about how things could or should be improved, and that they didn't share vocabulary for describing what was going on. And so what we took home from that is that our field generally within wraparound, and actually I think within other sort of person-driven planning type of or person-driven types of interventions, needs to get better clarity about what good and not so good practice looks like as far as really running a family or youth-driven conversation. So we are in the process of developing, next please, you can, so what we call booster modules that are interactive online modules that people can go on, get the didactic information, see video clips, and actually practice coding some very short segments, 6 minutes, and then seeing how their ratings compare to those of master coders. And we're going to be pilot testing that soon, so if you want to find out about that and when it happens and maybe be part of the pilot test, you can join our list at the National Wraparound Initiative, NWI. You can put it in your web browser. Okay, very quickly, takeaways. You know, these are just sort of some summative type of comments. Definitely preparation for wraparound meeting is key. When young people know what's going to happen in the meeting and that that's the meeting that they're preparing for is the actual meeting that's going to happen, I would say 90% of problems or potential problems surrounding youth participation are eliminated right at that step with good participation. Again, have the meeting that the young person prepared for, and make sure that the focus remains on planning, not venting therapy or what we call finger wagging, where everybody tells the young person how bad they screwed up last week because they got suspended or whatever. Make sure people are following up on what they said they would do. Help people who are working with young people get those specific skills for youth or family-driven conversations, and collect some data so you can see how you're doing. So those are our takeaway messages. Next. All right, well, I think we have time for at least a couple questions, if there are some. John?
Oh, yes, there are. One of them has to do with, there's an increased, one of our participants noted increased desire for wraparound services for transition age youth, but I guess they can only provide that service up to 18 unless they're previously involved in RAMP. And that's a funding issue with their grant. Do you see any changes on the horizon so youth who are in transition can be supported with Wraparound?
Yeah, I mean, I think increasingly we're seeing places that are extending the availability of children's services or of transitional youth services offered through their children's services up to age 21 and even 24. And certainly there are wraparound, a number of examples of wraparound programs that are serving young people up to those ages as well. So, and in some cases the work to develop that sort of transition age system has been done under a grant. So there's nothing, I mean, at least there are several kinds of grants, including the System of Care Expansion grants and also the Healthy Transition Initiative grants that are available from the federal government that can support your state or community to plan to make that expansion and to figure out how it can be funded and integrated so that there's sort of seamless services for young people as they move between the sort of child, adolescent, young adult, and then into the adult system.
Mm-hmm. And then the other question that we got regarding how would you meaningfully engage a young person in planning when the young person refuses services, and he feels that this is especially relevant for those who are over 18 years old.
Mm-hmm. Well, I mean, I believe that the techniques that we are using are the same kind of techniques that are generally very engaging to people. So I think that most people, if they really believe that you can help them achieve things that are significant and important to them, that's the way to get them engaged. I think that one thing certainly is not necessarily coming at people and saying you need this service or this service or this service, but how can I help you, what are your goals, and understanding and being patient that if you really think they need this kind of therapy or this kind of treatment, that telling them over and over again that that's what they should be doing, or even telling them once, is likely to be off-putting. Again, I think that's also why we're exploring increasingly the peer-delivered services, because peers definitely have a leg up as far as being able to engage each other or appear to a young person, and there's a level of credibility there where they may get a foot in the door where you know, you might not be able to. I'm going to ask Caitlin and Mary Beth to see if they have anything to add to that. You guys?
Yeah, absolutely. I think that you covered it well, Janet. I just think that if there's somebody who really doesn't want to engage in a service at that time, trying to quote-unquote convince them to do so is actually going to be detrimental and maybe turn them off to services. If somebody doesn't want to engage in a service, it's really important not to push them, let them drive that process, and particularly related to Wraparound, remember our principle of being youth and family driven. So allowing them to make choices on what it is that they do want to engage in, if that includes formal services, and if they don't, then exploring other options.
Definitely. I think it all comes down to youth voice and choice and making sure that you apply that to everything that you're doing.
Okay, great. And those were basically the questions that we had. Some others were answered through the chat feature. And I think that's all the time we have for today. So Janet, do you have any concluding comments or?
No, I just want to thank everybody for joining us. We are very passionate, I think all three of us who have been on this panel, about this work, and we encourage you, if you're interested in learning more, to be in touch. And certainly to sign up for the listservs, as I mentioned, because as we work through these studies that are coming, and hopefully future ones, we'll be letting people know what we find out from those types of resources, and then that we publicize through the list.
Great. And I just want to remind everyone that our webinar slides and recording will be published online shortly with our collection of webinars. And you can access our website from the URL you see on the screen in front of you, pathwaysrtc.pdx.edu. And I'd like to thank everyone for participating today. Have a great day. Bye-bye now.